about y'all, but over the last several days, I've seen so many posts talking about dental care, the exorbitant cost of dental care, the lack of access to dental care. And in those discussions, there's always the question of why is dental insurance separate from medical insurance, especially when we know that dental health and personal health are well aligned. And as an economist who studies how we pay for healthcare, I want to walk you through why this is. So let's look to history. So in the US and more broadly globally, both dental care and medical care, both educationally as well as professionally, have been separate. Physicians for centuries have been trained at medical schools, and dentists professionally have been trained at dental schools. And this separation of individuals pervaded into the 1930s when we started talking about developing insurance. Now, what's interesting is that in some of the earliest forms of universal healthcare that we can point to that were developed in the 1930s, there was an urge to lump together both medical insurance as well as dental insurance. However, as I'm sure we can all guess, that universal system never came to fruition. And so, combined with factors including an opposition from organized medicine and financial constraints during World War II and racism, it led to this creation of the US healthcare system as we know it, which is this private, mostly employer-sponsored system. And the reality is that when this system was created, it was primarily created for reimbursement for hospital costs, right? For medical care that you receive at the hospital. And most dental care, if not all dental care, is not given at the hospital, which is why medical insurance first developed to not include dental care. And like a lot of things in US healthcare, this idea that dental insurance and medical insurance are separate continues to this day. And while there have been small policy proposals and adjustments to include dental care, right? For example, the Affordable Care Act in 2010 made children's dental care a necessary medical benefit. For adults, that has not been the case, right? Which is why you see such a difference between medical insurance as well as dental insurance. Now, the reality is that medical insurance and dental insurance are inherently covering two different things and are structured in a way that covers two different things. For medical insurance, in the way that is structured, it is to cover the cost if you have a catastrophic medical event. So for example, if you have a heart attack or you get hit by a bus, medical care is meant to cover that cost of that catastrophic, surprising event, or else you probably will not survive if you do not have the costs covered in that way. Dental insurance is a lot different, right? Dental insurance is much more focused on getting primary care to individuals. And to the best of my knowledge, and some dentists can chime in here, there have been very few cases of people's teeth and the health of their teeth directly leading to them passing away. Of course, as we know, dental health can be linked to other long-term negative health outcomes. And as strange as this sounds, another argument why dental care is not included in healthcare is this idea that people just don't want dental care, right? So if you force dental care to be covered under regular medical insurance, that's going to drive up the cost of medical insurance, right? Because you're requiring the insurance company to cover that service. They're going to increase premiums. Now, as of recently, there have been efforts to change this. So in her 2024 presidential campaign, Kamala Harris actually campaigned on the idea of expanding traditional Medicare to include dental care as well as vision and hearing coverage. However, as we've seen, a lot of why US healthcare doesn't make a lot of sense is because it's this piecemeal system historically that we just choose not to address in the present and the future. And I know for a lot of Americans, especially what I've seen online over the last several days, it has led to a lot of frustration. And for now, unfortunately, that's all I got. As always, if you have any questions, let me know.